In Wakefield, we have a vision for our citizens to live longer, healthier lives supported by people who have the right skills in the right place. We are turning this vision into reality through Connecting Care. That's health, social and voluntary organisations working together to join up services for local people. In this film, we aren't going to tell the story of what has already been achieved in Connecting Care. Instead, we want to tell you about how we have responded to the national challenge, the Vanguard challenge laid down by NHS England. The challenge came early in 2015 to find new care models which will act as the blueprints for the NHS moving forward and the inspiration to the rest of the health and care system. This was our opportunity to move things further, faster for the people of Wakefield, and our confidence was justified when we were awarded funding for 2 Vanguard programmes in our district. This film tells the story of West Wakefield. In the jargon, it's a multi-specialty community provider. You can see what it means in practice in this film. The other is a care home Vanguard which is helping to improve the care of people in residential and sheltered housing across Wakefield. Listen and watch the people who are already making a difference to some of our most vulnerable residents.
Wakefield is very lucky in that we've been selected to be one of just 14 places awarded this funding. So what that means is there's quite a lot of money for us to use to implement the new model of care which we're designing in Wakefield for the benefit of our patients. What we have to face is the reality that our population is ageing, which is good news because we're all living longer and healthier, but we are going to be getting greater incidence of dementia and people with multiple long-term conditions to manage. And that's going to put a big strain on the health services. So what we're trying to do is reorganise our services a little bit so that we can look after people better at home for longer and reduce the number of hospital admissions as necessary.
Care navigation is the process where the patient actually rings up and they're wanting to either see or speak to a doctor, they're wanting a GP appointment. And what we now do is ask them the nature of the problem, just so that we can point them in the right direction, because not everything needs to be seen by a GP or a nurse.
If they need to see a doctor or a nurse, if they want to see a doctor or a nurse, then that's available. I think about 25% of the appointments that we actually have in primary care could be dealt with by another service.
Yeah, we are saving a GP appointment, but we also feel that you've also seen a more specialised practitioner. It could only help in saving not only GP time, but also saving patient time in the fact that they're getting in right at the start of the condition, which is always generally easier to treat when something's new.
They can be signposted to the pharmacist.
The opticians also do a pair scheme.
There are support groups out there.
Also, we've got midwife appointments as well.
With local people, with local knowledge who are often working in reception areas, providing increased choice for patients. We're actually making the better use of resources.
Innovation is absolutely essential.
It's a good way of working. I do think it is the way forward.
It's freeing the GP time up.
We could offer a lot in this type of environment.
I'm hoping that the overall system will seem a lot more joined up to patients.
The Care Home Vanguard project is all about better coordinated care for the most vulnerable people out there in the community.
The Vanguard project is designed to integrate care between NHS and acute sector and the private healthcare sector and improve communication.
The problem with people in care homes is that they're very frail and have multiple needs, and these people are cared in effect in the private sector, and often care home has its patients registered with multiple practices.
But that can mean that sometimes care homes have 7 or 8 different GP practices going into their homes and into their residents.
And with this fragmentation, you get problems with care. And what we're trying to do is actually design care around the individual in the care homes and around the care homes themselves, so they've got coordinated care for all their patients. So when there's a problem, the care home knows who to contact, who's going to respond, and what sort of response they can expect.
We've now got an allocated GP, which means that all the residents know who their GP is and the families all know who the GP is.
We've been able to prevent hospital admissions because they've had that link person.
This project is making life better for older people by allowing us to test out different types of engagement and assessment and care so that we can understand the best models to take forward and roll out across the country.
I think the Vanguard programme is a very exciting innovation to try and change the models of healthcare within Wakefield.
We've got lots of support.
It's a lovely place to be and I feel lucky.
You never feel lonely. I made loads of friends.
Happy, content and well looked after.
I'm enjoying every moment of it.
We feel a lot more connected as part of the Vanguard.
It's going to be a quicker, easier, slicker service.
When the practice, the staff, the GPs, the care homes collaborate together, the patient can only benefit.
And we're hoping that NHS England will be able to say to the rest of the country, these work, this is what you need to do, and this is the learning that we've got from Wakefield.
What the Vanguard does is wrap around Wakefield a support structure with resources to be able to get faster, further, and then achieve a sustainable system in the future.